Avoid these foods to protect your prostate. Prostate cancer is one of the most common forms of cancer among men worldwide. This condition affects the prostate gland, which is part of the male reproductive system and plays a crucial role in producing seminal fluid. While genetic factors and advanced age play important roles in prostate cancer development, increasing evidence suggests that diet plays a significant role in its prevention and progression. The relationship between diet and prostate cancer has been extensively studied, and it is known that certain foods and dietary patterns can influence the risk of developing this disease as well as its progression. In this video, we will explore how diet can affect prostate cancer by examining the foods and dietary patterns that can promote prostate health and those that may increase the risk of related problems. Understanding how diet can interfere with prostate cancer is essential for developing effective prevention and management strategies for this disease. Find out below which foods you should avoid to protect your prostate. Number 1. Dairy. Dairy products such as milk, cheese, and yogurt are common in many people's diets, but excessive consumption may not be beneficial for prostate health. One of the main reasons is the calcium content in these products. Studies suggest that high levels of dietary calcium may increase the risk of prostate cancer. Excess calcium can interfere with hormone regulation, increasing the production of dihydrotestosterone, DHT, a hormone associated with prostate growth and the development of conditions such as benign prostatic hyperplasia, BPH, and prostate cancer. Additionally, some dairy products may contain high levels of saturated fat, which can also contribute to prostate health problems such as inflammation and an increased risk of cancer. Another important consideration is the potential impact of dairy products on inflammation. Studies suggest that chronic inflammation may play a significant role in the development of prostate problems, including prostate cancer. Certain components of dairy products, such as casein and lactose, may trigger an inflammatory response in the body. Additionally, processed dairy products, such as cheeses and ice creams, often contain additives and preservatives that can increase inflammation. Therefore, to maintain prostate health, it may be beneficial to limit the consumption of dairy products, especially those high in calcium and saturated fat, and opt for healthier alternatives such as plant-based milks and lactose-free yogurts. Number 2. Vegetable oil. Vegetable oils such as soybean oil, corn oil, and canola oil are often used in cooking due to their affordability and widespread availability. However, excessive consumption may not be beneficial for prostate health. One of the main problems associated with excessive consumption of vegetable oils is their high content of omega-6 fatty acids. While these fatty acids are essential for body functioning, an imbalance between omega-6 and omega-3 in the diet may contribute to inflammatory processes, increasing the risk of inflammation in the prostate. Chronic inflammation in the prostate can lead to conditions such as prostatitis and an increased risk of developing prostate cancer. Additionally, many vegetable oils undergo refining processes that may result in the formation of harmful chemicals such as acrolein, which have been associated with cellular damage and an increased risk of cancer. Exposure to these toxic substances may contribute to prostate problems. To promote prostate health, it is recommended to limit the consumption of refined vegetable oils and opt for healthier sources of fats such as extra virgin olive oil, avocado oil, and coconut oil, which are rich in omega-3 fatty acids and have anti-inflammatory properties. If you're looking for a complete life transformation over the next 3 weeks, then you're in the right place. We present you the Smoothie Diet, the weight loss program that is revolutionizing the world due to its speed and effectiveness. Whether you need to lose the last 5 to 10 pounds or you want to get rid of 40 pounds or more, this will work for you. This diet is extremely flexible, so even though this program is 21 days, you can continue using it for as long as you want to lose as much weight as you want. In this program you will receive the complete 21-day weight loss and health improvement program, over 36 delicious fat-melting meal replacement smoothie recipes, shopping lists for each week to make it super simple to get everything you need, and smoothie making tips and prep guide to make sure there is zero trial and error. In addition to receiving 2 more bonuses to further enhance your weight loss. For more information, access the link in the description, or the link pinned in the first comment. Number 3, sugar. Excessive consumption of sugar, whether in the form of sucrose, fructose, or high fructose corn syrup, can have negative effects on prostate health. Firstly, high sugar intake is associated with an increased risk of obesity and insulin resistance, both of which have been related to prostate cancer development. Obesity is associated with a higher risk of aggressive prostate cancer and recurrence after treatment. Moreover, diets high in sugar can lead to fluctuations in insulin and insulin-like growth factor 1, IGF-1, levels, which can promote the growth of cancer cells in the prostate. Studies suggest that insulin and IGF-1 may play a role in the development and progression of prostate cancer. Another important aspect is that sugar can contribute to inflammation in the body. Diets high in sugar have been associated with elevated levels of inflammatory markers, which can increase the risk of inflammation in the prostate. Chronic inflammation in the prostate is related to an increased risk of developing conditions such as prostatitis and prostate cancer. Therefore, to promote prostate health, it is recommended to limit the consumption of sugary foods and beverages and opt for natural sources of sugar such as fruits, in moderate amounts. A balanced diet rich in vegetables, fruits, whole grains, and lean proteins can help maintain prostate health and reduce the risk of related problems. Number 4, unfermented soy. Unfermented soy products such as tofu, soy milk, and isolated soy protein can be controversial when it comes to prostate health. Some studies suggest that excessive consumption of unfermented soy may have adverse effects on the prostate due to the phytoestrogens present in these foods, especially isoflavones. Phytoestrogens are plant compounds that have structures similar to human estrogen and can act as agonists or antagonists of estrogen receptors in the body. Concerning the prostate, there are concerns that phytoestrogens may interfere with male hormone levels, including testosterone, and potentially increase the risk of prostate cancer. While some epidemiological studies suggest an association between high levels of soy consumption and a reduced risk of prostate cancer, other studies have shown conflicting results, suggesting that more research is needed to fully understand the impact of unfermented soy on prostate health. Additionally, some unfermented soy products may contain additives and preservatives that may not be beneficial for prostate health. Therefore, for individuals concerned about prostate health, it may be prudent to consume unfermented soy products in moderation and opt for more natural and less processed sources of plant protein, such as beans, lentils, and whole grains. Number 5, alcohol. Excessive alcohol consumption can negatively affect prostate health in several ways. Firstly, alcohol is metabolized in the liver into a substance called acetaldehyde, which can be toxic to cells and cause oxidative damage in the body. This oxidative damage has been associated with cancer development, including prostate cancer. Additionally, chronic alcohol consumption can increase estrogen levels in the body and decrease testosterone levels, which can promote prostate growth and increase the risk of conditions such as benign prostatic hyperplasia, BPH, and prostate cancer. Another concern is the impact of alcohol on inflammation. Excessive alcohol consumption has been associated with an increase in systemic inflammation in the body, which can contribute to inflammation in the prostate. Chronic inflammation in the prostate is related to the development of conditions such as prostatitis and an increased risk of prostate cancer. Additionally, alcohol can increase the risk of health problems that, in turn, affect the prostate. For example, excessive alcohol consumption is associated with a higher risk of obesity, type 2 diabetes, and cardiovascular diseases, which can increase the risk of developing prostate problems. To promote prostate health, it is recommended to consume alcohol in moderation. Dietary guidelines generally recommend limiting alcohol consumption to a moderate amount, which is defined as up to 1 drink per day for women and up to 2 drinks per day for men. However, individuals with specific concerns about prostate health may choose to further limit alcohol consumption or avoid alcohol altogether, depending on their needs and personal preferences. Number 6, processed meats. Excessive consumption of processed meats, such as sausages, bacon, ham, and other meat products that undergo curing, smoking, or preservation processes, can have negative impacts on prostate health. One of the main concerns is the high content of saturated fat and cholesterol present in these meats. Excessive consumption of saturated fat has been associated with an increased risk of aggressive prostate cancer as well as benign prostatic hyperplasia, BPH. Additionally, high cholesterol levels can contribute to inflammation and an increased risk of cardiovascular diseases, which are in turn associated with a higher risk of prostate problems. Another concerning factor is the presence of additives and preservatives, such as nitrates and nitrites, in processed meats. These chemical compounds have been associated with an increased risk of cancer, including prostate cancer. Nitrates and nitrites can react with other substances present in the meat during high-temperature cooking processes, forming compounds known as nitrosamines, which are considered carcinogenic. To promote prostate health, it is recommended to limit the consumption of processed meats and opt for healthier sources of protein, such as fish, chicken, lean meat, and plant-based protein sources. Balanced dietary choices and a healthy lifestyle, including a diet rich in vegetables, fruits, and whole grains, can help reduce the risk of prostate problems and promote overall health. Thanks for watching until the end. Don't forget to like, subscribe to the channel and share with your friends.